A warm welcome to all of my viewers. First of all, we begin with the session and we pray for Lord Dhanvantri. Om Dhanvantraya Name. And Lord Dhanvantri is the creator of Ayurveda. So now today we had scheduled this session regarding a success story of health and healing. And I am Dr. Sahil Gupta, an Ayurveda expert from IAFA Ayurveda, the world first Ayurvedic institute who is working on food allergies. So here is Teja, a vibrant
Hello, doctor.
young guy from Sydney, Australia, who is having refluxes since childhood due to milk intolerances or allergies and M.H.A few years ago. So today we will do conversation with Teja's father, Mr. Mohan Murthy.
Hello.
We are going to be live directly with
Yeah.
both of them regarding their success story of healing. And after endoscopy or other investigations reports, over there, the physicians revealed the diagnosis of Eosinophilic Esophagitis in case of Teja. So, first of all, Mr. Mohan, kindly update to our audience about yourself.
Sure. So, first, thanks to Dr. Gupta. Thank you for doing a, doing a wonderful job. Really heartfelt thanks for that. Um,
Welcome.
Tej has been diagnosed um, with the Eosinophilic Esophagitis about 12 years in 2012, about 12 years back. What happened was one day he was having some dinner and then he was coughing and vomiting. So we took him to the toilet and he was vomiting and blood came out. I was in a big panic, what to do, and straight away went to emergency. They admitted him. He was there for nearly 4 days. They diagnosed him and then finally they said we need to have an endoscopy done. They did the endoscopy there and then said that he's got his eosinophilic esophagitis. Um, so I was asking, so okay, it's like something like a headache. Oh yeah, what you need to do? So they said no, you need to put it on Pulmicort, which is steroid based. So at that time, I didn't have any options. I had to go with these steroids, although it was not long term. It was not doing good to him at all. So a lot of mood changes and other things happens with that. Um, so that was continuing, and then every year, initially it was like every 6 to 8 months, but after that, every year they wanted to do the endoscopy just to make sure that it is controlled, not eliminating, just controlled.
Okay.
So yeah. So
Means I interrupt you. When you observed that he's doing vomiting and the blood came out, and what was the age at that time?
2012, so I used 23, 13, about 12 years, when he was 12 to 13 years.
And right now, I think so. Teja is of 20 years of age.
21. He's
21,
21.
21. Sorry, 20.
Yeah.
Okay. Okay. So means you are saying that not permanently. Means they are controlling the symptoms. Means the endoscopy is done repeatedly only to review that
Yeah.
what is the stage of eosinophils count or esophagus, right? Means at the present
Yeah.
situation. But whole of your journey from that 2012 or 2013 that you are saying to till when you came to IFA, I think so in September 2023 you had taken the first consultation. Okay,
Yes.
so as
Yes.
per the prescription, I am reviewing over
Yeah.
here in my
Yeah.
system.
Yeah.
So
Got it.
on in September 2023,
Yeah.
you had scheduled the first consultation with us. So during this period, you are saying that means you are giving the treatment and you are following the treatment plan, and even you are you can say that the Teja is always uh, do investigated for eosinophilic counts again and again, and there will be what will be the prognosis at that time during that 5 6 years.
So just continuing with what I was saying, as I was progressing every year, they were saying that yeah, it's under control. In some years, they'll say it's under control. In some other year, they'll say, oh, it has elevated. So you need to increase the dosage. This
Okay,
continued continuously until uh, 1.5 year back before I saw you, and
okay,
then that is when they said, sorry, this Pulmicort thing, it's not working as much, but we have to introduce the PPI, which is the proton pump inhibitor.
okay,
Um, when they introduced that one, that has got even more side effects. And when I
okay.
asked the specialist, he said, how long you need to be there? Sorry, we can't determine. It may be for lifelong. But when I did some research on that one, PPI is not good for him at all. So luckily, I googled a lot on alternative medicines, because I know this Western medicine, it is good. I'm not saying it's bad, but all it was doing was just masking the symptoms.
So,
That
in this session, we will discuss about the questions, Mr. Mohan, that
Yeah.
some of the parents are willing to take online consultations, but they have no so much confidence that how so far away they will get or avail
Yep.
the proper consultations, the treatment, the medications, and all. So, this session, particularly, the main motto of this session is that means you will be giving you can say that your feedback or review regarding your son health
Yep.
journey, so that that will be helpful to other peoples also who are seeking for the treatment of eosinophilic esophagitis. So my first question is that how did you came across IFA Ayurveda, and what made you choose Ayurveda for your son's treatment?
It was purely an accident. Like, I was researching a lot. As I said, once the doctors said that it may continue, that the PPI may continue for lifelong, then I had to do something. I had to find out
Okay.
some solutions. So trying, checking in the Google, um, and then also checking the reviews and other things. And whatever I was doing, your thing was coming with a lot of positive reviews. So for me, I am a good believer. I'm a believer in the natural thing where it cures rather than just masking. So that is how I found IFA.
Okay, okay. So, can you share your experience with IFA online consultation program or process?
So the initial process was online consultation, like exactly like this, one-on-one. So you have seen Teja ask several questions. You didn't decide then and there itself, but then you asked for all the history, the one that I told before, and all the reports, everything I provided. Then you did the diagnosis, and then you said that, so, eh, okay, these are the schedule, these are the Ayurvedic medicine schedule that Teja need to do it. And what was really interesting was you also mentioned that cut down this pulmicort on every alternative days, not to
Okay.
continue the same.
Because some parents have doubt that they have to parallelly proceed for the other medications along with the Ayurveda, but it's means I always try to taper off. Not we will just taper off immediately. We
Yep.
will proceed in a you can say that way like that on alternate day basis, then on every third day like that. Okay,
Yep.
and I know that you had visited over here physically also in mid of the treatment plan.
Yes.
So initially you proceed with the online, and in between or in mid of the treatment plan you visited over here in IAFA also.
Yep.
Good, good. So how did our team guide you during your first consultation? Means you approached us and you built a confidence, and I think so initially the always my team is in contact with the query. So so how they were satisfied with their guidance or something? that
Uh,
means
what should I say? It's excellent. The follow ups are excellent. Even sometimes, even if I miss 1 or 2 days, they will keep pinging me, asking me, "Hey, what is happening and what is the
okay.
progress?"
Means
And
they keep on continuously means check for your regular follow-ups and ask you
yes,
regarding everything.
100%,
How is the
100%.
treatment going on?
Yeah.
So my other question is that how easy or convenient was it to follow the prescribed Ayurvedic treatment plan for your children? Means some parents think about that means how the childrens will means intake the Ayurvedic pills or the treatment or the Ayurvedic medications as they that are very bitter in even taste. So how is
So with Teja, initially as a my wife and myself, we were giving him, uh, but later on we said that he need to be independent too, and then started making very clear that you need to have this aharamrutam or whatever the medications you said that this has to be done, and he followed one on one.
so
Right.
did your son experience any kind of side effects after continue means after starting the Ayurvedic medications as compared to conventional treatments?
What should I say? Absolutely nothing.
Okay, okay. So apart from that, regular follow-ups, you had already updated me. That is in my question mark.
Yeah.
Okay. And right now, means what are the main dietary changes and lifestyle changes? Means we had suggested during the treatment plan. Do you, if you are comfortable to share such kinds of, you can say that dietary changes with the, you can say that audience or not?
No, no, happy to share whatever is needed. I mean, if
Okay.
it's going to help other kids, I'm so happy to do
Okay.
that one.
So
So
means the main dietary plans that we means had recommended you to change and the lifestyle changes. And I forgot to mention that there is a some skin condition. I think so. The tinea versicolor is also there over the back. So
yeah,
that is also I think so recovered now.
yeah,
For that we have to I think so we have to maintain a proper dietary regimes or some lifestyle
yes,
changes also. I think so.
yeah. With my son, with having this underlying autism condition, that
Okay.
was a little hard to follow. But at the same time, once told properly, he was sticking onto the regime too. So
Okay.
it was good. It's good. He was able to follow. Yeah.
So
So
my
I'll
next
give us
question
a
is
small
that
example. Uh,
yes.
when you mentioned that you should not have peanuts, the groundnuts, then even when accidentally if he get anything, he would take daddy peanuts. I should not eat. He'll give it back to me.
Okay. So my next question is that means your son overall quality of life means what is the change do you observe since starting the Ayurvedic treatment?
Um, one is that the fantastic thing is this endoscopy is being done yearly once. They don't want to put the probe in every few months. So
Okay.
yearly one is the process. So I have to wait for that 1 year. And to be honest, with that 1 year, it was always a bit skeptical. Hey, what is happening? Is it working? It's not working. Always it's that. But the last endoscopy when I did, and then when I went to I was praying everyone. And when I got the results, they said, no, there is no eosinophilic counts.
So I will update to the audience or the viewers that the Teja comes in September 2023 for his treatment, and at
Yes.
that time the biopsy and the endoscopy was done. And I think so Mohanji, you had shared the recent biopsy report in October 2024,
Yep.
and approximately it's 1 year. After 1 year in the biopsy reports means I am reviewing that there is no eosinophils count.
No.
Means during 1 year of treatment plan means you are following the treatment, conventional treatment or whatever else it will be from last
Yep.
many years, but there is no such kind of uh, endoscopy reports in the past that is
No.
showing that there is no eosinophils count. So after a year of treatment plan means on Ayurveda means there is no eosinophils count as per the biopsy report. So that is the major change, I think so, in your life, and I
Yes.
think so in Teja life also.
Yes, yeah. And heartfelt thank you for you, doctor. Yeah.
Welcome, welcome. So my next question is that means describe IFA Ayurveda contribution throughout your son's treatment.
Mhm.
Means uh, already we had discussed about this question, I think so. So means did you how did the personalized care and 24 into 7 support from IFA makes a difference in your son recovery?
The follow-ups, I should say, it's great. Whether it's reaching the medication, or whether it's a next consultation, whether it's a periodical consultation, even before me asking, hey, I need to have this consultation, your team would ping me and then say, hey, we need to have the consultation.
Yeah, okay.
I
Means
don't get
always.
this sort of things in other places. I mean, as a parent with the autistic son and with all these issues, you could imagine how many places I would have gone through, and how many physicians and how many doctors I would have gone through.
And I think so. Means, how do you rate that? Means during the whole treatment journey, means we never charge for any regular follow-ups again and again. Okay, to keep or to uh, means to avoid the communication gap between a parents as well as the doctor or the physician. Means the IAFA make a schedule that we never charge for follow-ups again and again, so that there will be no any kind of communication gap between parents or the patient and the doctor. So apart from that, means uh, you are in Australia, and do you feel like that means you are getting the medications on a regular basis on time, or means do you have delays in your medications and shipments over there?
When I say that okay, and the medication is there within a week, not even a week, it's there. No
Okay.
customs issues, nothing, because the paperwork on all the custom declarations and other things is so good. For every medication, every ingredient has been listed. And to be honest, everyone would know Australia is one of the strictest place to get any medications or anything, particularly it's natural ones, because they want to protect their thing. And here, I never had any issues. Never.
So what do you advise, means your advice to the parents and other patients who are suffering from eosinophilic esophagitis or similar condition?
Please give it a try. You would never fail.
And your final thoughts or words or gratitude towards IAFA team?
For me, you are so close to go to cancerous.
Pardon?
Sorry. The doctor said it's so close to go to cancerous. Thank you.
No, 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 no. Don't so think like that, because this is a condition that is a treatable condition, and I think so. The main thing is that when we approach towards the holistic healing, also, so everything is possible, and only you have to faith, or only you have to proceed for the Ayurvedic treatment. Okay, it will take time. Some parents or some patients have doubts that how much long it will be, but I always update to them that nobody knows about the actual journey or the time. Means in some cases we will get results within 6 months, within year, or within 1.5 year. So it depends upon overall uh, recovery phases, as well as the relapses also, even, and the modification in the dietary changes, as well as the lifestyle changes, and even uh, the Ayurvedic medications quality and treatment. So the main thing is that the doctor as well as the patient or their parents or guardians both have to
Work together.
work together,
Yes.
because that builds the confidence in the parents also, in the child also, as well as the doctor also, because
Yes.
the
100%.
Ayurveda always takes time to cover the cases.
Yeah. Definitely. Yeah. Yeah.
So thank
Sorry.
you,
Yeah.
thank you, Mr. Mohan. Thank you to share your son journey with us on our channel and your experience. That will be very helpful to other viewers and other parents who are seeking for the treatment of EoE or eosinophilic esophagitis for their childs. Okay, and my final message to my viewers is that if anybody is suffering from eosinophilic esophagitis and any other disease or any other allergies, specifically food allergies, skin allergies, or nasal allergies, who are seeking treatment and looking for a holistic approach, so kindly contact us anytime from our website and book your appointment. The link is given in this live session also, means is attached with this live session also. So this session specifically is for you, and I especially appreciate Mr. Mohan, because most of the parents will not, you can say that, agree to share their success stories on the public platforms. Okay, but specifically Mr. Mohan uh, come in front of you to share his son health journey. So I really thankful to Mr. Mohan, and now we will end this session.
Thank.
Om
Thank you.
Dhanvantaraya Namah. Thank you, Mr. Mohan.
Thanks.
Thanks.